that we are in support of skilled workers that will go out there and maintain and make sure that we do have safety in food, our water, and all the products that we're using in the market. And this can only happen if we have people who are trained and who know what to look for when they go out in the public to source and to sample the products that are there for the community. So I think this is a good example, and this university being a pioneer for this degree, I feel very honored to be launching this particular program and this training, because I think this is what our country needs. If we are going to have people who are healthy, then we need to know what we are consuming, whether it's healthy, what we are planting, whether it's good, whether it's fit for consumption, even the soil that we are using, where we are planting, whether it's actually safe. So our public health officers can advise. After they do all this sampling, they work with other members across other sectors like agriculture, industry, and we'll be able to. And then, of course, then we get that information, because what happens at the health ministry? The health ministry and the people who are health professionals tend to mop up and to clean the outcomes of an unhealthy environment. And this is why public health officials and environment, especially environment health sciences, being trained here is going to go a long way. Environmental health will make sure that we get a reduction in communicable diseases, things like cholera, things like diarrhea diseases. If we take care of our environment, where we are drinking from, what we are doing, the rivers that run across wherever we are, and also even chronic airway diseases, the houses we stay in, are they well aerated, where the smoke and pollutions are coming from? These are going to reduce a lot of communicable diseases. And when it takes care of the nutrition, because when we walked around the laboratory, we realized they'll be sampling foods and telling us what is good for human consumption and what is not, is going to reduce a lot of non-communicable diseases. Take, for example, diabetes, hypertension. Just telling people about salt, telling people about refined sugars, and checking what's in the drinks that we are taking from the shops, the content of sugar, the content of salt in our foods, and advising people of the correct amount to take, to consume, will go a long way. That little information alone will reduce the prevalence of diabetes and the prevalence of hypertension. Reducing toxins in our foods, in our meats, in our chicken, in our milk, will reduce the prevalence of cancer.